Welcome to The Explainer. Today we're exploring the clinical machinery of therapy in super depth. If you've ever wondered how talk therapy goes from a simple conversation to a highly effective, scientifically backed intervention, well, you're absolutely in the right place. We're going to look at this entire process as a rigorous construction project, where psychologists build a highly customized psychological blueprint for every single client.
So I want you to step right into the shoes of a clinician for a second. Imagine you're presented with a really complex clinical puzzle, a mystery involving a real person's distress. How do you actually gather the incredibly complex data required to solve it? You don't just guess. You rely on a meticulous, step-by-step framework to map out exactly what is happening in their mind and their environment.
To ground this in reality, let's introduce a case study from our source material. We'll call her Melissa. So, Melissa came into treatment presenting with severe obsessive-compulsive symptoms that started right after the birth of her baby. But beneath those immediate symptoms of postpartum OCD was a deeply ingrained, long-standing schema, a core belief echoing three devastating words: I am a failure. The immense stress of new parenthood acted as a trigger, activating this hidden schema and setting off a massive chain reaction of clinical distress.
Okay, let's dive into this. Here is our roadmap. 1. Synergy of assessment. 2. Crafting case formulation. 3. Assessment report components. 4. Designing the treatment plan. And finally, 5. Monitoring, ethics, and culture.
Section 1. The synergy of assessment. Laying the foundation.
So clinical assessment is an iterative decision-making process, is the absolute bedrock of what we're building. By systematically integrating the client's history, their symptoms, and their environment through interviews and tests, a clinician establishes a baseline. Without this clear sense of how the person is doing right now, meaningful, customized care is practically impossible.
Section 2. Crafting the case formulation. Drawing the blueprint.
Now, what's really interesting about this slide is how we turn raw data into a working theory. Case formulation is the complex task of describing a patient entirely within their life context, while simultaneously developing clinical hypotheses that pull together a comprehensive picture. This formulation is exactly what allows clinicians to individualize generic, evidence-based treatment manuals to match a very unique person. Depending on the therapist, this blueprint might utilize a biopsychosocial model, blending biological and social factors, or maybe a psychodynamic model, focusing on unconscious processes and cyclical patterns.
Let's walk through the 6 precise micro-steps of formulation in super depth. First, you develop a comprehensive problem list. Second, you determine the exact nature, origin, and consequences of each problem. Third, you zoom out to identify the patterns connecting them. Fourth, you develop working hypotheses about what's actually driving the distress. Fifth, you refine those hypotheses through continuous assessment data and client feedback. And finally, you remain flexible, continually revising these hypotheses during treatment as new data emerges. It's literally the rigorous scientific method applied directly to human distress.
Let's bring Melissa back into focus to see this in action. The clinician working with Melissa used a cognitive behavioral, or CBT, model to formulate her case. By moving through those exact steps we just talked about, the clinician mapped out the connection between her overt postpartum OCD symptoms and that deeply hidden schema, I am a failure. The formulation proved that her distress wasn't just some random anxiety. It was a specific reaction to a lifelong belief triggered by a massive life transition.
Section 3. The assessment report components. The structural plan.
This multifaceted structural plan goes way beyond just a quick summary. It captures everything in super depth, from the initial referral question and client history to real-time mental status observations and standardized psych tests like the MMPI-2. It all culminates in a definitive diagnostic impression and actionable real-world remediation steps.
You might be wondering, why all this dense paperwork? Well, it's absolutely vital, because it answers specific referral questions. It provides clear statements to authorizing agencies and insurers, and it establishes an absolute baseline to measure future treatment impact.
Section 4. Designing the treatment plan. The building process.
And this brilliantly illustrates the stark contrast between long-term goals and short-term objectives. Long-term goals represent the grand vision, but you can't just jump straight there, right? You need short-term objectives, intermediate, highly attainable milestones. You don't just write "get better" on a chart. You write exactly what better looks like this week, basically providing a ladder for the client to climb.
The plan integrates the specific problem list generated earlier.
Interventions are detailed down to day-to-day tactics. Timelines are established. Typical evidence-based treatments like CBT usually run about 8 to 30 sessions, and outcome criteria are set so everybody knows exactly when treatment is a success.
Let's anchor this back to Melissa's mystery. Because her formulation was so incredibly precise, her treatment plan was equally targeted. The clinician utilized exposure and response prevention, or ERP, which is a gold standard tactic for OCD. But crucially, based on her environmental data, they integrated her husband Eric into the plan to help her manage specific homework assignments and break her cyclical patterns at home.
Section 5. Monitoring, Ethics, and Culture. Maintenance and Safety.
Ongoing treatment monitoring, like using brief psychological tests, yields some really striking results. When clinicians actively use this tracking data, client deterioration rates actually drop by a full third. If progress isn't tracking with typical profiles, it instantly alerts the psychologist to stop, go back to the blueprint, and reevaluate the formulation.
So the crucial point here is that therapy doesn't happen in a vacuum. It operates within strict, non-negotiable legal and ethical bounds. Clinicians must secure informed consent regarding the nature of the assessment and the fees, but most critically, they must outline the strict limits of confidentiality. A therapist is legally and ethically obligated to break confidentiality in cases of suspected child abuse or if there is a clear intent of suicide or plans to harm others. Safety always supersedes privacy in these specific scenarios.
And equally important to safety is cultural relevance. A deeply formulated plan simply cannot impose the therapist's worldview onto the client. Culturally responsive assessment demands a collaborative approach, where the client is treated as the absolute expert on their own life journey. Tools like the Cultural Formulation Interview, or CFI, found in the DSM-5 are utilized to ensure the clinician captures local and cultural variations in mental health, deeply personalizing the care.
This all culminates in the power of feedback. Before therapy even begins, the clinician sits down with the client to review the assessment findings together. They collaboratively agree on the treatment goals. In our case study, Melissa engaged in these exact feedback sessions, reviewing her findings and agreeing on her ERP goals with her therapist and her husband. It empowers the client, transforming them from a passive patient into an active architect of their own recovery.
We've seen how the complex machinery of psychological assessment builds a sturdy, life-changing blueprint, but it leaves us with a fascinating thought to take away. Given the super depth of biological, psychological, and social data required to understand a single human being, how might a clinician formulate the context of your life? What invisible schemas or environmental factors are laying the foundation for your daily experiences? Keep that in mind as you navigate your week. Thanks for joining me on this explainer, and I'll catch you next time.